Well, hello everyone. My name is Shelley Ann. I am one of the registered dental hygienists here at Wellington Dufferin Guelph Public Health. And it's Oral Health Month, so we thought what a great way to promote Oral Health Month by doing I guess this would be our second Facebook Live video that the Let's Talk Parenting Facebook page has offered. So I'm glad if you're joining us. Thank you for joining us. What we're going to talk about today are just some tips and tricks on keeping your toddler's teeth nice and healthy. We're also going to announce our winners of our Facebook contest that we had for Oral Health Month. So we were quite happy about all the people who participated in that contest. So we'll stay tuned till the end and we'll reveal the lucky winner. So one of our jobs here at Public Health is to help families access care through the Healthy Smiles program. Now, Healthy Smiles is, the core program is a income-based program. However, there is an emergency service program. So if your child is experiencing any sort of tooth pain, discomfort, or you have a concern, they might be eligible for emergency services. And that one is really for families who might be struggling financially. Maybe there's a change in their circumstances. So if you do need any sort of help that way, please give us a call at 1-800-265-7293, extension 2661, and we'll be happy to let you know if your child's eligible for some free dental care. Okay. Now, to start us off, one of the first things I'm asked is, what age should children start seeing the dentist? And they're really shocked to find out it's usually around the age of 1. And although they're not really going to get their teeth cleaned or anything like that at the age of 1, it's really just so that they can experience what happens at a dental office. And it also gives the opportunity for your dental professional, your hygienist or your dentist, to kind of talk to you about how to take care of your children's teeth. Because everybody's situation might be a little bit different in terms of your child's health and development. So it's always good to talk to them. They might be able to go for a ride in the chair or get their teeth counted, but don't expect like a full polishing or anything like that you might receive. Okay, we want to build some good experiences for them and leave them with a positive experience having their teeth counted for later in life. Now, the biggest thing that we deal with here are parents asking about, how do I deal with a struggling toddler? So I remember those days. I had a toddler too myself at one point, and it can be a struggle. So I just wanted to give you some tips and tricks that worked for my family. It might not work for yours, but go ahead and give them a try. And what I like to do is I like to give them the choice of what color toothpaste are they gonna use, what color toothbrush are they going to use? So if you have a few of those on hand, go ahead and pick one of those, let them pick, and let them do a good job brushing first. Let them experience that. They do want to build some fine motor skills. So, the whole manipulation of the wrist and getting into the mouth, they need to build that skill. It's not something that's going to come easily overnight. So they will need help brushing their teeth until they're around age 8 or 9. So that's one thing you want to let them practice, but when they're done, that's the time that mommy or daddy or another grown-up can get in there and help them with their brushing. And what I'd like to do the best, this worked the best for my family, is once they were finished brushing, I'd take them into the bedroom, lay them down on my lap, just like this. And because I'm a dental hygienist, I like looking at the mouth like this. I can see everything this way. So when they're laying on your lap, this is comfortable, especially if you're in your bed. And I usually had an old towel nearby in case they had any water that they wanted to get rid of. They didn't have to hop off the bed and go to the bathroom to spit that out. But if you're just brushing in this position, you can see everything. You can see the areas that they missed. You can see any yellow plaque missed along the gum line, which is really common at this age. They really don't know how to focus their toothbrush around the gum line. And you're going to just brush in small circles like we teach them, round and round. And this is a great opportunity for them to learn. Children learn best when they are interacting. So this is a great time to sing a song or count their teeth together so that you can count them 1, 2, 3, or, all around the circle like a teddy bear. 1 step, 2 step, tickle under there. And that's going to be a fun experience for both of you. Because after a long, hard day when you're trying to deal with a struggling toddler, it's going to be very challenging, to say the least. So if you try to go in there with a positive outlook, I'm sure it will become a fun experience for both of you, especially at the end of the night. The other thing that I get asked a lot is about the use of toothpaste, and when should families transition to fluoridated toothpaste? And we usually say fluoridated toothpaste is great once they can start spitting it out, because it's great when it's applied to the top of the teeth, but they don't need to be swallowing that, so they can spit it out into the sink. And that's usually around age 3 that they start to develop those skills. So training toothpaste up until then, and then once they can spit, they can start using the fluoridated children's toothpaste. Okay, and the other thing too is flossing. Flossing is something that a lot of people, when I see them in the chair there, they're not big flossers, but if you can get them started when they're young, it can become part of their routine. And as soon as those teeth start to touch together, that's when you want to bring out the floss. So, you know, they could be pretty young when you're trying to floss the teeth, and you might only be able to get in a few teeth at a time until they get used to it. So start with 1, the next night do 2, and move along until they're used to having their teeth flossed and have it become part of their daily routine. What else? Sippy cups. So sippy cups, we usually recommend that when children are transitioning from breast milk, they go straight to a cup. However, we know that, you know, in certain situations that might not be ideal, you know, if you're out and about. So we do recommend that we only put water in the sippy cups if you are going to use them. And that's because we don't want children to be sipping frequently on any sort of sweetened drink, fruit juice, or even milk. Milk has natural sugars in it, so that can actually help aid the formation of cavities. So we want to avoid that, because the more frequently they're sipping on that, the more frequently there's going to be an acid attack in the mouth. So we want to avoid that as much as possible. And then after that, those are kind of the main things that I have concerns about that I wanted to mention with you. Now, we do have some questions there. I'm not too sure if they're getting answered. I'll just have a quick look here. Oh, Rachel is saying her bathroom counter had a large space for her children to lay down on, so that's an option too. Just be careful that somebody's always holding on to baby at all times. We don't want any accidents that way, but thank you for the tip, Rachel. Oh, we have to announce our winner of our Facebook contest. So we did have 2 winners of our Facebook contests. One of them, however, did not respond back yet to our message. So if you have entered our Facebook contest, please go and check your messenger. I will have sent you a message. But our other winner is Terry out of Dufferin County. She was already by and picked up her prize. So congratulations, Terry. Yeah, so I'm really glad that everybody was able to. Oh, we do have another question. Hold on here. Aricia, what area do kids miss? Oh, they typically miss right along the gum line or down by the tongue. So we have Dino's tongue here, right down by the tongue. The tongue's very hard to brush around, so I usually have them open as big as they can, because the tongue will go back a little bit when they open big. And then down by the cheeks, right around the gums on the cheek side on those top teeth. Those are areas. So make sure you take your toothbrush or their toothbrush and focus on those areas, because those are likely the ones that they're going to have missed. All right. Well, that's great that we had some viewers today. I want to thank everybody for joining us for our Facebook Live video. I think we will I think we will end it there. All right. Everybody take care. Bye now.